infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, a week ago, there was an opinion piece published in Newsday entitled, "A Bold Plan Against Tick-Borne Disease." In this article, it states that a national public-private strategy is needed. Well, joining me now is the co-author of the article, Holly Ahern. Holly is an associate professor of microbiology at SUNY Adirondack. Professor Ahern, welcome back to the show.
Hi, Robert. Thanks for inviting me back.
You bet. Well, Lyme disease, and there's probably a dozen other tick-borne diseases of significance. And it's definitely a growing public health problem. There's no doubt about that in this country. Professor Ahern, what are the numbers? I mean, can you give the numbers that could illustrate to the audience the enormity of this problem?
Sure. So the numbers that I'm about to recite are derived from CDC surveillance. So in other words, that's the job of the CDC, which is to keep track of diseases and looking for trends. So these numbers are from 2017 because surveillance usually is a year or so behind. And in that year, 2017, the CDC reported that there were over 428,000 new cases of Lyme disease. And, over a period of time, there were another 60,000 cases of other tick-borne illnesses as well. So, and they also admit that the true surveillance numbers, that this may or may not be a reflection of the true number of cases of tick-borne diseases because their surveillance is designed to do just that, to, look at a snapshot, take, to determine trends and that sort of thing. And just to put this in context, when you look at that number of cases of new diseases in a year and you compare it to the 80 other infectious diseases that the CDC tracks, Lyme disease is number 2 out of all 80 infectious diseases that are tracked by the CDC. And it's second, but it's more or less tied for second with gonorrhea. Chlamydia, a sexually transmitted disease, is number 1. So obviously the disease is growing in number. It's probably been here underestimated for a while, but now that we're getting a better idea of how many cases there actually are, when you think about that, it is the second most common infectious disease in the U.S., and that's just the number of new cases per year.
Right. So definitely there is a growing public health problem. And you state in the article that we need a multi-billion-dollar national public-private partnership, and it must go beyond the current low-impact strategy. Professor Ahern, can you elaborate on what exactly you and your colleagues are asking for?
Yeah, I think the numbers illustrate that the number of cases of this disease are going up. And what we've been doing about it so far is to warn people, ticks are out there, tuck your pants into your socks, make sure you use your bug spray. But the numbers are increasing, and they're increasing dramatically every year. So these approaches are failing. So I'm on the advocacy side. I work on the advocacy side and on the research side. Medical doctors, especially family practice medical doctors, are on the front lines. They're the ones who people with tick bites are going to see first. They're the ones who are seeking treatment for their illnesses. And they're seeing an increase in the number of patients who are dealing with these diseases. So what we're saying is that this sort of approach that hasn't really been much of anything other than say, be careful, watch out for ticks, is failing. It's failing on several fronts. And so we need to do more to prevent disease and also to diagnose and treat the disease once people have it.
Right. And in the article, you and your co-author list 3 priorities. Can you go over those?
Sure. So we didn't necessarily agree in the order of those priorities. The physicians think that a vaccine is the number 1 priority. I would put diagnostic testing as number 1. I mean, they're looking at it from the perspective of let's prevent new cases. And I'm looking at it from the perspective of there are millions of people suffering with illness as a result of this already. many of those have chronic illnesses that are misunderstood completely. So my thought is we need to figure out who those people are, and we need to be able to diagnose them. We need to come up with treatments, especially early in the disease when it's the most treatable. So regardless, the three things that we highlight are related to what the findings of the Tick-Borne Disease Working Group, the federal working group that investigated these issues in more detail. And those issues were there are significant gaps in three areas: prevention, diagnosis, and treatment. And those are the same gaps that the advocates note. That's the same gaps that the doctors are seeing. So those were our three priorities. And as you know, from the article, we sort of reverse the order of those things. So, vaccine, most physicians feel that vaccines would be a very good way to prevent people from developing illness. Like I said, and many advocates feel we need a way to find out who actually has the disease now and come up with better ways to treat it. I also have concerns about vaccine safety. The original Lyme disease vaccine, if you're going to vaccinate against one single tick-borne illness, you're kind of leaving out the other 12. So, you're not protecting against tick bites or transmission of disease. You're just preventing people from getting, possibly developing Lyme disease as a result. So those are the major strategies that, these were laid out in the Tick-Borne Disease Working Group report. That was a report to Congress. It was a federal advisory committee. So this was an advisory notification to Congress, and there were very good recommendations made in that report, so maybe it's time to step up and use some of those recommendations.
Right. And you mentioned the Tick-Borne Disease Working Group, and they submitted the report, I think it was last December. And right. Other than these priorities, what else did they accomplish? Do you think it was a success?
I do. I think the first Tick-Borne Disease Working Group was a success in that we were able to do the leadership was excellent. We were able to do a deep dive in many subject areas that have been neglected over the years because, in particular, the pathogenesis of the disease, how the bacteria actually cause the disease, noting all of the significant differences in the medical approach to the disease does not match the pathobiology of the infection. So those were pointed out in the report. The very significant gaps in diagnostic and testing approaches were pointed out. In fact, the major conclusion from that particular subcommittee, which I served on, was that the current diagnostic tests, which are antibody-based, these are serological tests, it's so inaccurate that literally whether your test result is positive or negative, you are equally likely to have Lyme disease. So for physicians, that does not provide for very actionable information, right? So if I can't tell if my patient actually has Lyme disease or not from a blood test, what is the use of that blood test? So, the Testing and Diagnostic Subcommittee did recommend that it was time to move on, that serology was not going to solve this issue, that we needed to come up with direct diagnostic testing, in particular, ways to find out who is infected and who isn't. So therefore, if somebody's infected with the bacteria, antibiotics are appropriate. If they're not appropriate. So we need to be able to determine that.
Yeah. Well, I guess there's some good news on the horizon. I see that Valneva is working on the vaccine. And I recently spoke to... That's true. Yeah, and I recently spoke to Dr. Embers down in Tulane, and she's working with Enable, I think is the name of the company, working on a new Lyme disease test. So there's the wheels are turning in some areas. No?
Yes, in some areas they are. Yeah. They are rolling, so that's good news.
Okay. Professor Ahern, any final thoughts on any of these topics?
This is a huge problem, Robert. It is a bigger problem than most people recognize. It is a cause of chronic illness in the United States. I think an underestimated degree of chronic illness. And the approach, what my colleagues and I are trying to do is to just say, we need a larger scale approach to this large issue. And if we can achieve that, I guess we all have to decide that this is a very large issue first, which even the CDC is beginning to agree that, yep, this is a significant problem and we need to do something about it.
Yeah.
The issue is what to do about it. Prevention is one thing, but we also need to address the other aspects of that, the patient aspects of that. How to get diagnosed with these illnesses, and what treatments are effective. I think we are way behind the 8 ball when it comes to effective treatments for tick-borne diseases because of the remarkable biology of these bacteria.
Yeah. And for the audience, I will post the opinion piece from Newsday on the website when I publish the podcast. And I want to thank you, Professor Holly Ahern, for sharing your time with me today. I appreciate it.
Oh, thank you, Robert. I really enjoyed speaking with you.
Okay. Take care.